Now we're going to pick up where we left off yesterday. And yes, we'll pick up where we left off yesterday. But we're going to introduce a new term. If you haven't heard it before and you don't know it, I would like you to say what that word is that's on the screen.
Shalom.
Shalom. Now, anybody knows anything about what that word means? Peace. That's one of the meanings of the word shalom. But I am going to let you into a secret. Actually, it's not a secret. Shalom means more than just peace. It means everything that is good, complete, harmonious. Shalom is, if I were to greet you and say shalom to you, what I'm actually wishing for you is everything that is good. Did you get that? Yes. Now, when everything is good and everything is harmonious and everything is complete, that produces in you what? Peace and harmony, right? And calm. So that term is actually the word that is best translated from the Bible to mean health. That's what health is. Everything that is good. Does that exclude anything? No. Is it only about physical things? No. Is it only about mental things? No. Is it only about spiritual things? No. It's everything that is good and complete and harmonious working together. Isn't that wonderful? And that's the term that encompasses all of that. So when people greeted each other and they said shalom, that's what they were saying, that everything that is good, may that be yours. So this morning I want to greet you with that word, shalom. Okay? That everything that is good be yours. Now, yesterday we saw this from 1 Corinthians 10:31. So whether you eat or drink or whatever you do, do it all to the glory of God. Okay? Do it all to the glory of God. That means that we have to look at what's going on with new eyes. Right? We're not just eating to satisfy ourselves. We're eating what? To the glory of God. We're not just drinking to satisfy ourselves. We're drinking to the glory of God. We're not just taking care of ourselves and those around us for ourselves. We're doing it to the glory of God. We don't just take care of our families because it's just, something that we have to do. We're actually doing it to the glory of God. You get the idea? So this is a very important and all-encompassing idea. Whether someone believes in the Bible or they don't believe in the Bible, if they encompass this idea in their heads, it's going to make a difference in how they see the world. Whether you pick up the paper that's on the ground or you leave it, let it just make a mess. Okay? All right. And we also talked about this idea yesterday. Remember that? Yes, sir. Soup. Okay? So are you guys making good soup today? Yes or no? Yes. All right. And when you went out this morning, and those of you who had a struggle up cardiac hill, you did not drop dead. No. Okay? You took it slowly, and you got up, and you came in, and everything is working fine. Praise the Lord, right? Amen. You did it. You were making good soup. Last night, hopefully, you got a good night's rest, right? Yes. Okay. And even this morning, when the rain came down, there's something that happens when the rain falls on hot ground. It actually produces some negative ions, and you guys inhale those negative ions, and you are much better off for having done that than if you kept locked inside somewhere, all right? So even that helped you to feel more buoyant this morning, okay? So you were making good soup when you were out in the sun yesterday, assuming you didn't go out there to sunbathe and get sunburnt, right? You were making good soup because you were making enough vitamin D. You get the idea? Yes. So we're making good soup on the inside. Now we also talked about Alice in Wonderland, which is a fairy tale. Okay, it's not really true. But the concept that we were using is going down the rabbit hole, going down and seeing what's in there, because it looks as though things get stranger and stranger, and it's so interesting that some of the things that are so complex may actually turn out to be very simple. Okay, and we're going to try to simplify some of those today as we go down that rabbit hole. Yesterday, we talked about the outcomes that are associated with adverse childhood events and experiences. And I want to highlight the things over here: the cardiovascular disease, diabetes, emphysema, cancer, obesity, etc., and hypertension falls into this group because part of these diseases is, of course, hypertension. Cardiovascular disease includes high blood pressure, and we're going to be talking about those two today, diabetes and hypertension. Children who have these adverse childhood experiences actually have an increased risk of developing obesity, diabetes, depression, etc., heart disease, cancer, strokes. You know what the major indication for stroke is, the major thing that produces strokes? High blood pressure, okay? Hypertension is the number one factor that facilitates people developing strokes. We don't want to have that. Severe obesity, I mentioned. Cancers, I know everybody is interested in that because everybody knows somebody who has had cancer, okay? Even though we're not going to be talking much about cancer in my sections. We also talked about this. If we understand the adverse childhood experiences, then they, and how they impact the development from childhood all the way up to adulthood, we see that people who have these experiences actually may even adopt different behaviors, some of which we would consider bad behaviors or not conducive to having good health, but actually what they're trying to do subconsciously is to cope with the problems that they've had, and this is trying to ease the pain. Now, this is a bad way to ease the pain, because when you're using drugs to ease the pain, the drugs will never ease the pain, right? You have to deal with the pain. You have to deal with the cause of the pain. You get the idea? All right? So the hope that we have is that once we understand this, then we'll try to find help in the place where help can be, right? And this involves this holistic view that we're using of body, mind, and spirit. This is the view that allows people to become whole again, okay, from brokenness. We also talked about what's happening in the first 9 months of life when the baby is, or the fetus is in the mom. We talked about what happens before conception, and then we talked about intrauterine life and what's going on there. If the mom, I didn't say this specifically yesterday, if mom eats as though she's eating for two, she is going to end up with some problems. Because she's not eating for two, she's eating for one and a fetus. Did you get the difference? She's not eating for two adults. She's eating for her and a little fetus, okay? So if she overeats and overgains weight, okay, that baby is going to be affected. Similarly, if she doesn't eat enough, okay, that baby is going to feel the stress of not getting enough nutrients. That's going to affect the baby. For instance, if the mother does not eat enough during the pregnancy, that child can experience incomplete development of the muscle of the heart, okay? When are you going to see this problem? Usually not when the child is a child. You're not going to see it when they're an adolescent. What you might see it is when the child has now become an adult, 30, 40, 50 years of age, they end up with congestive heart failure, and everybody wonders, well, why do you have congestive heart failure? Well, that's because mom, during pregnancy, during the time that the heart was developing, mom wasn't eating right. Are you following what I'm saying?
What about
okay?
when they overeat?
When mom overeats, that also puts stress on the baby. The child has an increased risk of developing diabetes and hypertension in their 40s. Okay? So, you know, somebody might say, I know people who can eat anything, anytime, anywhere, they don't gain weight. I just pass by the bakery and I smell the pastry and I start gaining weight. You know anybody like that? All right, well, not quite, right? But there's some people, it seems as though anything they do, they gain weight. And you wonder, how come this could be so? Well, part of it is related to the metabolic programming. Can you say that? Metabolic programming that happens during the time that you were in your mother's womb. Okay? You had nothing to do with that. But because we all have those risks, because mom, bless her heart, the mothers in this room notwithstanding, okay? Mom, bless her heart, even though she did everything that she thought was right, may still have been overlooking some things. Okay? So we all end up being born broken and with risk. Therefore, if we know we have risk, then what we ought to do is to live a life that mitigates, that reduces that risk. Does that make sense? Yes. Because we all have it, okay? All the more reason why we should be more careful about what we do, and that care should not be something that overtakes us. Let me tell you, the best communities in the world that live the longest, that live the happiest, aren't people who are fastidious about what they're eating and drinking and how they're living. No, it just becomes part of their natural way of being. If you're too worried about what you eat and too worried about what you drink, that worry is going to cause you problems. You get what I'm saying? Okay? That worry is going to cause you problems. So, even the Bible talks about this. It says, don't have any anxious thoughts about what you're going to eat or what you're going to be or what you're going to drink. No, the key issue here is no anxious thoughts. Don't be anxious about this. Okay? We say if you know to do good, happy are you when you do it. Does that make sense to you? You say, this is better to do. Okay, I'm going to do it. I'm going to do it until it makes me happy. All right? Does that make sense to you? All right? So if we're going to be adopting a new way of living, if we want our bodies to be under new management, okay, we have to change some very basic things, including the way we think, because that's where it all starts. Okay? It all starts up here. How we think about what we're doing. Okay, now, in talking about going deeper in this, down the rabbit hole, we got to the point of delivery and C-section, right? We just mentioned a little bit about metabolic programming, what mom, the food that she eats, how much she eats, whether she exercises, whether she sleeps right, even the music that she's listening to, the attitudes she has, the beliefs that she has, the fears that she has, the joys that she has, all of these things create a soup in her, and that soup then influences the soup that the baby or the fetus is having, and therefore it influences the growth of the fetus and what's going to happen with that fetus later on in life. And that's going to produce this metabolic programming thing. Okay? Now, how about how the baby is delivered? Well, many ladies prefer to have this cut than the one going down the center, right? Because it looks a lot more aesthetically pleasing. That's what they say, right? But really, what is going on is that we have a big difference here. During a normal vaginal delivery, the baby actually comes down through the birth canal, right? That's what we'll call it, the birth canal. The baby comes down the birth canal. With a C-section, the baby bypasses the birth canal and comes out through the abdominal wall, okay, surgically. Now, you might think, so what's the big deal? What's the big deal? Well, fetuses, as they're growing, there's one thing that they learn how to do early on, and that's they learn how to suck, all right? So when we take ultrasound pictures or we take fetoscopic pictures and we see what's happening to the baby, oftentimes the baby is sucking the thumb, right? And we know that the baby sucks because the baby ingests some of the amniotic fluid, and that is what produces this, the first dark stool that the baby has, which is called meconium. That is actually the amniotic fluid that has been digested by the baby. So the baby ingests all of this. Babies learn how to suck before they're born. Thank God. Because after they're born, that is their lifeline, okay? If they can't suck, they're going to have a difficult time getting nutrition because that's how God made us to survive, to live by sucking, to be able to get the mother's milk, okay? If the baby doesn't have enough suction in their suck, not only does the baby suffer, but the mother will not produce enough milk, okay? So the baby has to learn how to suck, and this happens during intrauterine life. Why am I talking about that? Well, when the baby is coming down the birth canal, okay, that baby is sucking, okay? Inside the womb, the baby is sterile. There are no bacteria in there, okay? But when that baby is coming down the birth canal, as non-aesthetically pleasing as it might sound, that baby is coming down, all right? The baby is sucking. Okay? It's getting all that secretions and whatnot. It's going into the mouth, into the nostrils. It's getting on the skin. Okay? And these secretions are not sterile. They have bacteria. And these bacteria then populate the baby. Did you get that? Yes, this now populates the baby. Now, when we bypass this mechanism and we have a C-section, where is the bacteria that's going to populate that baby? It won't come from the birth canal. Where is it going to come from? The hospital. It's coming from the hospital. Do you think that the germs in the hospital are the same as the germs in the mother's birth canal? No. Well, we have enough evidence. No, they're very different, okay? And in case you thought that these bacteria were just innocent bystanders, they are not. As a matter of fact, you sitting right there, any one of you, you have more bacteria in your gut than you have cells in your body. Isn't that something? You have 10 times more bacteria in you than you have cells in your body. So, even though you don't see them, I want to let you in on an idea. You're not alone. We're not alone. We have these bacteria there. And they're not inert. It's not that they sit around and do nothing. They actually help to program our immune system. They actually are an interface between the things that we eat and actually what gets into the body. Because when you eat, it actually goes to the bacteria first. And what the bacteria does with it makes a difference in what is eventually going to get absorbed by us. Did you get the idea? It's as if I am standing on the inside of the blood vessel, right? I'm inside the blood. I'm in the body. And out there in the back of the room, that's the gut. That's where the food comes. And you guys are the bacteria. So anything that has to go from there to here, who do they have to pass? You, all right? And what you do with that food will determine what is left for me to take. Does that make sense to you? Yes. All right? So the bacteria are very important. It's called the microbiome. And it's very, very important in terms of what is going to happen with individuals. So the effect of this is when we have a problem, even from how the baby is born, we may have a different set of bacteria that is inhabiting the fetus, actually the newborn baby, depending on how the baby is birthed. Okay? And that, my friends, is going down the rabbit hole one more step. Because we have these microbes, they produce metabolites. They themselves have genetic material that express or not express, that may be turned on and turned off by what we eat and what is going on in the environment, the mother's milk or so, if we're talking about the baby. And this has ramifications all the way to different proteins and metabolites that then get absorbed into the body. So what's going on with these bacteria makes a difference to the baby, and it makes a difference to us, even as adults. So here is what was published some years ago by the British Medical Journal, a very respected medical journal. It was looking at the risk to children who were born by C-section versus those who were born with a normal vaginal delivery, right? This is the risk of asthma through normal vaginal delivery. This is the risk if they had C-section. Is that higher or lower? Higher. But it's not just asthma, even though this study only looked at asthma and reported asthma. We now know that everything from some of the inhaled allergy problems to eczema, neonatal eczema, and what we call atopy, multiple allergies, all of these things are increased in people who are delivered by C-section versus those who have a normal vaginal delivery. Am I making sense? Okay. Now, so as an adult, you have an allergy, and you say, well, nobody in my family is allergic to this. Were you born by C-section? If you're born by C-section, you have a higher risk of it. It doesn't mean that you're going to have it, but it means that the risk to you is higher. Okay? Obesity, look at this. Children who suffered from obesity, who were born by vaginal delivery, 15.8% risk. If they were born by C-section, higher risk. Okay? Higher risk. Are you hearing what I'm saying? So here is somebody and they say, I don't understand why I'm gaining all this weight. My question, how were you born? I can go all the way back to how were you conceived. You get the idea? But they don't know that. You don't know how you were conceived. But you do know whether you were born by C-section because mom or dad or somebody would have told you that. Right? And by the way, your head would be rounder if you were born by C-section as opposed to molded when you come down the birth canal. Okay? But here, we have a 25% increase in obesity by just being born by C-section compared to vaginal delivery. And then if we look at people with type 1 diabetes, okay, type 1 diabetes, it's increased the risk. What this doesn't show you is that the entire metabolic syndrome is increased. In other words, you have an increased risk of type 2 diabetes, you have an increased risk of heart disease, that's high cholesterol, high triglycerides, dyslipidemias, we call it, right? Higher risk of heart attack, higher risk of high blood pressure, higher risk of stroke, just by being born by C-section. And you did not have one thing to do with that decision. Somebody else made that decision for you. If you have that risk, therefore, it means that it's more urgent that you take you take the steps that are needed to prevent a problem from happening. You get what I'm saying? Because it's not as if you don't have any risk. We have the risk. Okay? All right. So now, let's see if we can put things in perspective by seeing how we can think about things. What do you think about this statement? To feel or act differently, we must purposely think new thoughts. What do you think about that? You see, it starts in the mind. Ideas have consequences. If you have new thoughts, those will lead to new actions. If you consistently provide these new actions, then you will have new habits. And the new habits will produce a new life. Are you hearing me? So even though you're here for a makeover, I would assume for you that the most important makeover that you have to have is a makeover of your mind. Yes, yes. So that you will not be conformed to the world the regular way out there, but you are transformed by the renewing of your mind. Okay? And this renewing of your mind is not just a physical renewing of your mind, an emotional, mental, and spiritual renewing of your mind as well. Okay? When that is accomplished, you are now on the way to becoming a new creature. And the old things you will leave behind, and the new things you will adopt. Are you hearing what I'm saying? Okay. So of all the exercise that you have to do, and you must do the physical exercise, okay? I'm not trying to take you off the hook there. Of all the exercise that you have to do some mental, spiritual exercise. Okay? So that your mind will be changed. So that your heart will be changed. When that is changed, the rest is gravy. All right? Okay, so this is what it looks like. There are the French fries and the hamburgers and stuff like that. Okay? And here's a sedentary lifestyle. Now, you know, these things have gotten a bad name, really, you know, hamburgers and French fries. But it's just a symbol of not eating right, okay? I mean, we can make some veggie burgers that you will, to die for, but you don't have to die while eating it, right? Okay? So the sedentary lifestyle, people call them couch potatoes. I call them sofa pumpkins, right? Because they sit and they're spread, okay? There you go. Well, this, plus what's going on in our environment, which sometimes we have no control over, but sometimes we do, and our genetic predisposition, which we don't have much control over, but epigenetically we have some control over, and we're going to talk about that. Somebody's going to talk about that here, right? Okay? Well, then, what that leads to is a whole host of different things that go on, including this thing here, which is called visceral adiposity. And I'm going to spend a few minutes just to talk about that. The problem, believe it or not, is not just an issue of being overweight. Are you aware of this? Being overweight is not the be-all and end-all of things. The question is, where is that weight distributed and what is causing the weight? If you're overweight because you have a lot of muscle, you think that's bad? No, that's usually not a bad thing at all. Okay? But if you're overweight because you have excess fat, see, it's over fat, that's the problem. Because the fat doesn't just sit there. Fat is metabolically active tissue. The fat produces stuff. Okay? So, not just overweight, but we look at over fat. So far, so good? Yes. Okay. Now, how do we look at this over fat? Well, the fat can be distributed in different parts of the body. There's something that we call gynoid fat. That's the way many women have a distribution of fat. They're not really necessarily very fat around the midsection, but they're fat around the hips and down the thighs. You know what I'm talking about, right? That kind of gynoid fat, by the way, is not very metabolically bad. She says, praise the Lord. Okay? That kind of fat is not necessarily bad fat. Okay? The fat that has the most metabolically adverse effects for us is the fat around the midsection. Okay? So we got that. So the apple shape is what produces the major problem, not the pear shape. Okay? The apple shape. Now let me tell you this. Just because somebody has gynoid fat or hip fat doesn't mean that they're immune from having abdomen fat. Okay? So there's some people who have double fat. Okay? All right. But then you might say, well, okay, then it's an issue of fat. But let me tell you, fat can be distributed under the skin, that's called subcutaneous fat, and fat can be distributed around the internal organs. We call that visceral fat. And guess what? Subcutaneous fat, the fat that we see, that's not the bad fat. The visceral fat is the bad fat. Okay? So we went all the way from being overweight to looking at over fat to looking at visceral fat. Okay? But all visceral fat doesn't have the same effect. Which visceral fat has the most metabolically adverse effect for us? It's fat that's distributed around the liver and in the liver, and fat distributed in and around the pancreas. Those two areas of all the research today, right? Those two areas are the problem areas. And guess what? There are skinny people who have increased hepatic fat, that's liver fat, and increased pancreatic fat. So you might see a skinny person, and that person develops diabetes or high blood pressure, and you say, how come? They don't fit the profile. Yes, they do. If only you could see what's going on the inside. See? But since we don't have X-ray vision, and we don't go around with an ultrasound measuring everybody, we don't know what's going on the inside. Therefore, we say, how come? But now we know why. Are you following me? So there's something here for everybody, even if you're skinny. There is something here. If you have increased visceral fat, especially if you have hepatic fat or you have pancreatic fat, this is metabolically interfering with your well-being. All right? And that's what this slide and the next two slides, looking at what is supposed to be happening, is part of. Now, when we have this increase in visceral fat and we end up with this syndrome, this metabolic syndrome, we end up with a whole host of risks for things. We have what are called lifestyle diseases, cancer, Alzheimer's disease, anxieties, sedentary lifestyle, too much sleep. If we sleep too little, less than 6 hours a night, we double our risk of diabetes. Did you know that? So you say, okay, thank you very much. I'm going to sleep more from now on. But if you sleep 9 hours or more a night, you triple your risk of diabetes. So don't say if a little is good, a lot is better. No, there is a space, okay? And basically we're looking at 7 to 8 hours sleep a night is optimal for adults. Can you tell me what that number is again? 7 to 8 hours sleep per night. Okay, notice I didn't say per day. I said 7 to 8 hours per night, okay? You know, today we have the ability to change night into day by putting on all the lights and doing all of that stuff, right? But it's better if we were to sleep at night and be up during the day, right? With the natural cycle of things. Now I know, we live in a complex society, somebody has to be up at night. If you're going to be up at night, then you really need to convert your entire life to a nocturnal life. In other words, don't try to double dip. It's the double dipping that causes the problem then, right? So if you're going to be a night person, you're going to be a night person. You have to have night friends. You have to, you know, night owl. I mean, that's how you have to live. You have to live that way. Now, in saying that, we all know that even though you're a day person, you still have hours of the night that you're awake. Isn't that right? Okay? Similarly, a night person still has hours of the day that they're awake, so they can get some things done during the day too. They just have to rearrange their schedule, and they can't double dip. They can't say, well, on the weekends I'm going to be a day person, and during the week I'm going to be a night person. It doesn't work that way. You have to be consistent. Yes, ma'am.
Are you saying sleep, or say you're in bed and you're just resting, but you're not really sleeping?
Okay, that's not the same as sleep. Yeah. Sleep. Yeah, like sleep.
Can you get a 5-hour nighttime sleep and a 2-hour nap in the daytime? Does that count?
I wish it did. I wish it did. It's better than nothing. Okay? Okay, yes.
My question was, can you get 5 hours in the evening, nighttime sleep, 2 hours?
During the day, if that adds up. That is better than just having 5 hours at night and nothing during the day. But it doesn't fully make it up. Okay? I wish it did. For many years, I used to sleep 4 hours a night, period. 4 hours. And I would be good to go. And I thought, man, I have a big advantage. As a matter of fact, it did give me a big advantage in school and in things that I had to do because I had more waking hours than other people. Okay? All right. So I started to look. There must be some advantage besides just this, you know, I must be a superhuman, you know what I mean? Because there are other people like this, okay? Margaret Thatcher, for instance, 4 hours a night. Okay? So I looked and looked and looked, found nothing. I have been looking now for over 30 years. I have not found one study, not one, that says that sleeping less than 6 hours a night or 6 hours a day, 6 hours per 24 hours, gives you any health benefit. None. None. I have no studies that say that. So now I'm going to let you into a secret. If you guys would find something and show it to me, we're in business. But I doubt you'll find anything because there just isn't any data like that. Yes, ma'am.
Yes, Dr. Zeno, I think the ladies here are probably looking at the same cause where we are not able to. We want to sleep that time, 6 hours, 8 hours, but because of hormonal issues, we're just not able to get that kind of sleep. What do we do?
Okay. This isn't a sleep talk, but I'll just make mention of a couple of things. First, if you don't intend, you never will. In other words, if you fill your time up with other things, and we all have other things to do, right? You fill your time up with other things, then you'll never make the intention. So you have to intend. That's number one. Number two, there's a whole body of study now called chronobiology. Chrono meaning clock, right? Time biology, where we know that instead of some people being able to get, which is the dominant pattern, 7 or 8 hours continuous sleep, we now know that there is a significant number of people who that's not how they're programmed. They're programmed to have about 4 hours of sleep. They wake up, okay? They do something, 15, 20 minutes, half an hour, and then they go back to sleep and they sleep another 3 or 4 hours. They might think that they have an interruption in sleep, that they don't get enough sleep, and at the end of those 4 hours, they get up and they say, well, what am I going to do? And they do something else. They didn't wait long enough to fall back to sleep, you see? So that's the thing. What we know now is that people who have that kind of cycle, if you get up after 3, 4, 5 hours of sleep, you can do something, but don't do something too stimulating, right? You give it a chance, okay, and you fall back to sleep and you'll get the rest of your sleep. And this, in the studies that have looked at these individuals, they do not have any of the problems considered to be sleep deficit problems. So they're actually getting all that they need, and it's a healthy pattern. It's just it's a different pattern from 8 hours straight. Okay. Third thing is that there are some things in our foods that can help us, and some herbs that we can use to help us. Black cohosh is one that comes straight to mind that helps with that. Some of the soybean related extracts, or the soy itself, can help, because what soy does, soy has phytoestrogens, and these things help to moderate the estrogen lack in postmenopausal women that can interfere with their sleep. So those are a few things that we might want to do, but sleep hygiene is part of it. The other thing that's important is, along with the intention, is that you have a routine. You have a bedtime routine, right? What you're going to do, how you're going to do, you're prepared to sleep, right? You take off the distractions, you take off the lights, you go into a dark place, etc., and all of these things help. I know some people, they have television all day, all night, okay? Some people say, I can't sleep unless the television is on. Things like that. Well, these things actually are disruptors to sleep as opposed to aids to sleep. So those are some issues. I'll take the last question and I'll go on.
Oh.
Yeah.
How do you account for instance, my intent is to sleep 7 or 8 hours. And I may go to bed, quite often I do go to bed at 8 o'clock. But my sleep is disrupted 4, maybe 5 times because I have to empty my bladder.
Okay.
So does that affect my continuous sleep?
Yes, it does. But if you're going to get the total amount of sleep, it is not as bad as if you didn't get the total amount of sleep. So if I would, for instance, if you were to be my, if you were to be my patient, one of the things that I would ask you, and you don't have to answer it in public, is that if you wake up in the morning, if you feel rested. So it's not just the amount of sleep, but you have to wake up feeling rested. If you wake up feeling rested and you got the requisite numbers, you're doing far better than if you woke up and you're still tired, you still want to sleep some more. You get the idea? The interruptions, both for women and for men, of having to use the restroom, this is part of kind of the pathology that we go through. For the men, it's the prostate, and for the women, it's the size of the bladder, right? Gets a little bit smaller, and so they have to get up and go and use the restroom. If when you get up and you use the restroom, you saunter back into bed and you fall right asleep, that is not as big a disruption as if you couldn't go back to sleep. Can I move on so that otherwise I will not get through with what I'm supposed to? Okay, I was saying that that these things cause lifestyle-related diseases, and in these lifestyle-related diseases, 2 of them that we will highlight will be diabetes and hypertension. Now, part of the process involves sensitivity to insulin. Under normal circumstances, a little bit of insulin goes a long way. It's like living in a good economy where a few pennies or a few dollars really, you can get a lot of groceries out of that. But when things are not quite like that, now this is a picture of supposedly the pancreas, that's the liver, that's the fat, that's the muscle, okay? The pancreas produces the insulin. That goes to the tissues. These tissues, here they are, liver, fat cells, and muscle. These tissues, if they are sensitive to the insulin, they do what they need to do, and there's a nice feedback mechanism and everything works fine. Beautiful. Harmony, health, shalom. We say this is wonderful, right? No blood sugar problems. All right. Now, when there is insulin resistance, it means that the tissues don't respond the way they should to the normal amount of insulin. They don't respond the way they should. In other words, it's like when the economy is bad and there is inflation. The dollar isn't going to buy you what a dollar used to buy you before. So in order to get that, what do you have to do? Fork out more money. You get the idea? So what does the pancreas have to do? Fork out more insulin to get the same response. Does that make sense to you? Yeah. Okay. Now, what is causing this insulin resistance? I told you already, physically, if there is fat deposited in the liver and fat deposited, if there's fat deposited in the liver and fat deposited in the pancreas, this is associated with an increase in insulin resistance. The body is more resistant to insulin. Okay? But even with resistance to insulin, if by having an increased amount of insulin, the organs are still responding and doing well, the blood sugar remains normal, everything is fine. It's just at a higher level of insulin. Okay? Now, I say everything is fine, it's not really so. Because that higher level of insulin is associated with some other things. The higher level of insulin is also associated with an increased risk of heart disease. So insulin resistance itself and high insulin levels in the blood is not an innocuous condition. But at least the blood sugar isn't high. You get the idea? And that's what the doctor is going to check. He's going to see if he or she is going to see if your blood sugar is higher than normal and if your hemoglobin A1C is going up. So the doctor would say, okay, things are going okay. Now, when the tissues don't respond the way they should, regardless of the amount of insulin that's there, we have surpassed the benefit of the tissues being responsive and responding. And by surpassing that, oftentimes what goes on is that the pancreas now isn't able to keep up with the demand. The bank account runs dry. You can't produce any more dollars to get your groceries, all right? So we end up with a problem. Diminished insulin response, we still have the same amount of insulin resistance, the blood sugar begins to rise, okay? And that, ladies and gentlemen, is in a nutshell from normal to pre-diabetes to type 2 diabetes. Once the body is not able to keep up with the demand, you end up with diabetes, okay? Type 2 diabetes. The other parts of the body that are involved in this, we talked about the fat tissue, we talked about the pancreas, right? The gut also plays a part in it, not just from the microbiome, but we have other hormones that are produced by the gut. We have what's going on with the bacteria in the gut, and we also have issues of what's happening with the brain, because there is a constant communication between what's happening in the periphery of the body and what's happening in the central nervous system with the brain. Insulin also acts on the brain, for instance, okay? All right. Now, there are some lifestyle factors that increase our risk of developing type 2 diabetes. If one is considered kind of average, then if we were to have an active physical life, we'll do fine, okay? If we add to that a healthy diet, we'll do even better. If we never smoked plus we have an active lifestyle, plus we're eating well, then we're doing even better. If we have moderate to no alcohol consumption, we're doing even better. So it's an additive effect. If we have normal weight, we're doing better. And if we have a lower waist circumference, we're doing better, because the waist circumference is what's going to tell us about the visceral fat that's on the inside. You get the idea? So the more of these healthy things that we have, the lower our risk of developing type 2 diabetes. You see that? All right. So this is what's going on. I like this picture a lot. You notice how nice and clean that looks on the inside there and everything, and they're working fine, right? And this is what you're eating, and this is what's happening on the inside. It's just an artist's depiction of how that is. But if you're doing this stuff, okay, yeah, there we go again with the hamburger and French fries, right? Then we have a rusty system on the inside, and I mean, they're always trying to fix something, right? Because we always have something to fix, okay? Because what's going on is disruptive to the harmonious functioning of the body. Now, the energy that we expend, the amount of calories or energy that we take in, the composition of the food, the environmental chemicals. Yesterday I gave you a term for the external chemicals. What do we call that? Exochemicals, right? The microbiome, all of these things affect the environment. They either facilitate the development of obesity or development of type 2 diabetes, and we end up with beta cell dysfunction. That is, the pancreas doesn't function the way it should, and this leads to the development of type 2 diabetes. Okay? Now, not all people who are obese develop type 2 diabetes. Only about 30% of obese people develop type 2 diabetes, but you know why. Because the issue is not just obesity. What is it? Where the obesity is, where the fat is, where the fat is. Okay? That's what makes the difference. Okay? So all of these are involved in the production of metabolic soup. And the soup could either be good soup or not so good soup or bad soup. Okay? Now, I'm going to walk through this with you. I'm going to do one for diabetes and I'm going to do one for hypertension. So I want you to please pay attention. So those of you who are taking a nap, this is a good time to stand up and stretch. Let's do that. Stand up and stretch. Okay?
While we're stretching, can you go back to that one picture with the...
Sure, just for you to see. Okay. All right, so we take a little stretch. Up in the sky. Okay. Down. Let's do it one more time. Up in the sky, up on your tiptoes if you can, right? And down. Okay, one more time. Up. All right. Now, one more thing I want you to exercise, and that is your lips. You turn to the next person and you give them a big smile. Let's go. See, I got you to smile, didn't I? Okay, good. Please, have a seat, and now we're going to go on to the next. All right. Here we go, ladies and gentlemen. We're going to go fast through this. So I want you to, okay, engage. All right, here we go. This is the population. That's the whole population. We can divide the population into people who are normal, so-called, pre-diabetes, and type 2 diabetes. All right? Now, the people who are normal, or, the blood sugar is not high, they could be either low risk or high or at risk. Okay? They could be either low risk or they have risk. All right. So now, what happens as time goes on? The people who are low risk, they can become at risk. Once they become at risk and they don't do anything about it, then they end up with prediabetes. If they have prediabetes and they don't do anything about it, then they end up with type 2 diabetes. Are you following me? And once they get the type 2 diabetes, if they don't do anything about it, then they exhaust the reserves of their pancreas, and eventually they'll need to have insulin. Did you get that? So let's go through it one more time. In the whole population, we have people who are normal, pre-diabetes, and type 2 diabetes. The normal individuals could be either low risk or at risk. If they're low risk and they don't do anything but they live the Western lifestyle, they will sooner or later become at risk. Once they become at risk, if they don't do anything about it, they actually end up with prediabetes. If they have prediabetes and they don't do anything about it, many of them will go on to have type 2 diabetes. If they have type 2 diabetes and they don't do anything about it, what's going to happen is that eventually the beta cells, the pancreas, will get fatigued and they will end up needing insulin. How many of you are saying, man, I can't wait to take insulin? Come on, raise your hand. Nobody here? I can't wait to take insulin. I've always wanted to take those shots. Man, they look so good. And there's a nice new, really slick pen. You can put it in your pocket. Really good. Anybody? No. Most people don't want to do that, okay? But, it's not about fear. It's about living a good life, harmonious life, eating, drinking, and being merry and having a good time, but doing it in a way that is healthy, health-producing, as opposed to something that's health-damaging. Does that make sense to you? Okay, now let's go. We have this. Let's go a little bit further. This zone, I call it the red zone, because this person, they have to interact with the healthcare system or they die, okay? And that's where most of the health dollars are spent, right there, okay? This person has a problem, they have a complication, they have blindness, kidney failure, whatever, right? Heart disease, that's the issue. This zone here is the yellow zone. This is the risk zone. It's like you're going across the intersection and the light is yellow. You're at risk, but you can get across safely. Isn't that right? Okay. So, the issue, while you're here, in which direction do you want to go? Towards red or you want to go backwards? Backwards. You want to reverse this process so that you end up in the green zone. You see? Now, the thing is, the reality is, you can move from here to here to here. You can. But not everybody. I wish I could tell you everybody would do this. Not everybody does that. What else am I going to tell you? The further along you are, the less likely it will be that you'll be completely reversible. Okay? All right. Let's go a little bit further. This is the patient. This is the system, the healthcare system. And we're looking at control. Dr. John Kelly is the one who developed this particular model. He says, and it's the truth, that as you go from this side of the system where you are low risk, all the way to having type 2 diabetes and having the complications of type 2 diabetes, the system, the healthcare system, gets more and more and more involved and more and more and more in control.
That's right.
Okay? If you look at what happens with the patient, as the patient moves from here, that is you and I, as we move from here to over here, we become less and less and less in control. By the time you get here, when you have to be on dialysis 3 times a week, who is in control of your life? Somebody else. The system is in control of your life. When you have to go into the hospital, in the emergency room, every 3 weeks or so because your blood sugar is out of control, who is in control? Not you, right? The system has you by the throat, okay? My question is, who is in control of your life? Who do you want to be in control of your life, okay? It's better here, right? And ultimately, I know that I can't take care of myself, but I have a God who is able to, okay? So I prefer to leave my life in God's hands than to put it in the system's hands unnecessarily, okay? If I have to use a system, then that's what God provides for me. Are you following what I'm saying? I'm not anti-medicine. I'm the appropriate use of medicine. You get the idea? But if I can be over here and I am walking and having a good time and I don't have to be stuck in a hospital or a dialysis unit or, getting eye injections and all kinds of things, let me hang out over here. I prefer that, okay? All right. Now let's look at it another way. This is a little bit more complex, but just follow along with me. We're going to start off with this blue line here. This is time, okay? With the blue line, we're looking at what happens to the person in terms of their resistance to insulin. It's what's going on in the body. Think of it as the amount of fat that's being deposited in their pancreas and their liver, right? So over time, they have more and more fat being deposited. They have more and more insulin resistance. Now, in order to keep up with that, the pancreas has to produce more insulin. So if you look at the pancreas producing insulin, which is from the beta cells, it's doing this, producing more insulin. But there comes a point where the pancreas, it's at maximum. It can't do anymore. And then it begins to fail. So it produces, but it can't keep up, and now it fails. And it continues at a maximum, but except its maximum is going lower and lower and lower, until now you're not producing any insulin at all. You're producing much less than is necessary for, that's healthy, okay? Now, what else is going on because of this? If you look at the fasting blood sugar, all while you're keeping up, the fasting blood sugar remains normal. But there comes a point where the discrepancy between the amount of insulin you're producing and the insulin resistance that you have causes the fasting blood sugar to go up and up and up and up. If we look at the blood sugar 2 hours after eating, you would see a similar thing, except this one rises much faster. So the 2 hour after eating blood sugar is the first one to go abnormal, okay? And that's the one that is the initial driver of the hemoglobin A1C. So when you get a hemoglobin A1C test done, you're looking at the composite of everything, but you spend more time after eating than you spend time eating. Okay? So this is what's going on there. Now, in the same way, I'm going to show you the zones. Okay? We can start off with the red zone. Now, you probably didn't see that very well. Let's try it again. You see that's the normal? That's the red zone. Okay? The red zone is where you already have diabetes. You already have diabetes. You're in the system. The doctor is telling you, look, you have to do this, you have to do that, you have to do that. Okay? If you're there, it doesn't mean that all is lost. Because if you're in the early part of this, it is still reversible for most people. Not everybody. But we're still thinking it's something that's reversible. Now, if we go the next over, we have the yellow zone. Okay? The yellow zone is the pre-diabetes. Things are not really out of control yet. If you leave them to themselves, they tend to get worse and worse. So you do something about it, right? And this is almost 100% reversible in the pre-diabetes stage. So you want to move from here now to the next one, which is the green zone. Okay? Now I also have a blue zone over on the left. Actually, the colors, I guess, got mixed up. But anyway, but the idea is if you can get to this zone, now you're coming back to a physiology that is more normal. Now, what does it mean when things get to a more normal? If we're to look at the hemoglobin A1C, we're looking at a hemoglobin A1C of 5.6 or less. 5.6 or less. If you get to that range, you can essentially say that your body is going to be functioning from a diabetes standpoint as if you do not have diabetes. Okay? If you are 5.7, 5.8, 5.9, you're still really functioning in the pre-diabetes range. Now, is it always possible to get it down to the normal range? Is it always possible? The answer is no, unfortunately, no. Because it depends on what's going on with your pancreas. Okay? If the pancreas has been damaged by the process already, or if when you were a baby in your mother, well, a fetus in your mother's womb, there was some insult that meant that the amount of beta cells that you have is less than the amount of beta cells that other people have, you had nothing to do with that. Nothing. But it's still affecting you today. You get the idea? Are you following what I'm saying? So your job is to produce the best metabolic soup that you can. But what happened with mom and dad before you were born, how you were born, you can't go back and change that. You have to deal with what you have today. Does that make sense? What's in your hand, that's what you use. All right? So now let's go on. This is the root of the problem. This is the fruit. If you hang out with the root, you're doing fine. The fruit is not so nice. If you let this move on, the fruit is not so nice. Okay? Now, here is everybody here, I don't know if everybody here has heard about the New England Journal of Medicine. It is the #1 medical journal, clinical medical journal in the world. Okay? Produced by the Massachusetts Medical Society, New England Journal of Medicine. Here's what they said in 2002. Lifestyle changes and treatment with metformin, which is glucophage, for those of you who are using medications, metformin or glucophage. Lifestyle changes and treatment with metformin both reduce the incidence of diabetes in persons who are at risk. Both of them did. Now let's see. The lifestyle intervention was more effective than metformin. Can you say that for me, please? So why, when you go to the doctor and you have prediabetes, the doctor is going to tell you, I think we need to start medications and put you on metformin? Why? Okay. Now, right now, we can bash the doctors. Right now, we can do that. This is the opportunity to bash the doctors. But I'm going to give you another side of the story. Doctors are smart. Doctors know that most people who walk into their offices will not change their lifestyle. They will say yes, 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 but what they really mean is no, no, no. Okay? Are you following what I'm saying? So the problem is not just a doctor problem. Okay? The problem is our problem. Let me give you an example. Do you know how much more cabin space we have at this retreat? Is Leah here or anybody? How many more people could we take into this summer retreat? Lots more? Probably twice the size? Where are those people? They're eating hamburgers and French fries, okay? Or at the doctor's office, okay? The doctors know that most people won't do it. Are you following what I'm saying? Now, why will somebody end up doing it? We heard that in yesterday with a doctor who was talking about motivation. What is it that will cause people to want to do it? Unfortunately, is when they get into the red zone. When the doctor is saying we need to inject insulin, or you're losing your vision, or I'm going to have to put you on dialysis. That's when the person says, I want to do something. But then, it's late. Are you following what I'm saying? Most people, ladies and gentlemen, just aren't sick enough. It's when they get sick, then they say, I ought to do something. Most people don't believe they ought to prevent something that they believe they're not going to have in the first place. This is a waste of time. If I can tell you that you will never die of a heart attack, no heart attack, will you be careful about what you eat that affects your heart? No, you'll say, I'm immune. Right? Does that make sense to you? And that's how most people live their lives. They live their lives as if we're immune until something happens. Or until something happens to somebody who's close to us. Like your good friend drops dead. He's my age. Oh, I ought to do something. Are you following what I'm saying? So while we can bash the doctors and we can bash the pharmaceutical industry and all of that stuff, and some of it might be merited and appropriate, ladies and gentlemen, the issue, when we point our fingers, we have several of them pointing back at us. We are the ones that are the major issue here. Okay? So now let's talk about the intensive change. Under new management. Okay? How many of you want to be under new management? Okay. So we're going to do this extreme makeover under new management. I found this slide on the internet. I thought it was I don't agree with body piercings and tattoos and whatnot. And I think this one wasn't really put. I think this is written on that person's back, not I don't think it's a real tattoo. Anyway, but I found it on the internet. I thought it was good to use. Okay, here are the things. Here are the elements. Okay? I think you know most of these already. First of all, exercise, right? Exercise. Sleep, we talked about that already. Feeding habits. Breakfast. You guys, you're indoctrinated already, right? Intermittent fasting. Now, you don't know what that is yet. But having a small supper or no supper actually causes you to fast overnight. Did you hear what I just said? The term that is used today is not overnight fasting. It's called intermittent fasting. It's not called 2 meals a day and no suppers. That sounds kind of negative. But if you say, I am fasting intermittently, does that sound much more chic, right? So what do you mean by an intermittent fast? I have my second meal around 4 or 5 in the evening, and I don't have anything else that has calories in them until the next morning. Now, is that so bad? No. How many meals a day do you have? I have 2. I have a nice big breakfast, and then I have a nice big meal in the mid-afternoon. You get the idea? Now, do you think you'll be hungry? Not if you eat the right satisfying foods. Right? Yeah, but if you stay up late at night, okay, there are things that happen late at night. It's happened to me. I remember I was giving a talk. I was at the Lifestyle Center of America, and we were talking about emotional eating. And I had some deadlines for some things I had to produce. I gave the talk that afternoon. I went home after we had family worship, and the family went to bed. I stayed up in the study. And in the middle of things, okay, I find myself, when I say find myself, I don't even know that I walked over there, but I found myself in the kitchen, okay, with the fridge open, okay? Now, I know whenever I find myself in front of, see, I'm the kind of person, I know what I'm going to the fridge for. I go, I put my hand, I get it, I use it, I put it back, right? That's how I am. So when I find myself in front of the fridge and I'm looking, I know that there's a problem, okay? And it hit me. I find myself in front of the door and I'm looking for something, you know, I'm going after something, right? I laugh. I was just talking about this today, and look, it's affecting me, right? So I close the door, I go back to the study, all right? About half an hour later, I find myself in front of the fridge again. Do you know what I did? I closed the door, turned off the lights, I went to bed. Are you following what I'm saying? See, I really wasn't hungry. I was having the munchies. I was having the cravings for things, okay? I didn't really need it. I go to sleep. In the morning, you wake up, you're nice, you're hungry, have a nice big breakfast, okay? Are you following what I'm saying? These are some practical things, but it happens to all of us. It happens to me, okay? So, intermittent fasting. De-stress, okay? Not distress. De-stress. We need to de-stress. We talked about that. No, we didn't, but the doctor who spoke yesterday talked about that. The diet, what it is that we're doing in the diet, what constitutes the diet, okay? We advocate a plant-based diet for more than one reason. But we look at vegetables versus fruits versus meats. We say, to the extent possible, eliminate the meats, especially the red meats. We say fruits, depending on whether you have prediabetes or diabetes, right? While fruits are good, not all fruits are created equal, right? The sweeter tropical fruits, it doesn't mean you can't eat them. It means you have to limit your portions, right? You don't go after 3 big juicy mangoes. So you go for half of a good juicy mango, right? All right. You can't eat half a mango? Then you eat 1 mango every other day. Okay? All right. Now, there are people who talk, do I talk about juicing? I'll get to that over there, all right? The cheese and the milk, you reduce these. Okay? By the way, soy milk is not milk. I have never seen a soy cow. Okay? Soy milk is actually a soy drink. Okay? It's made from the soy beans or soy protein isolate, etc. I am not here to discuss the issue of soy versus almond versus. I'm not getting into that. What I'm saying is that cow's milk, etc., for other reasons, in addition to control of your diabetes, may not be necessarily the best thing to go after, right? So we say, let's reduce these things or eliminate them from the diet. And for some people, they can do it gradually. For other people, they have to stop, okay? For many, stopping is actually the better way to do it than a gradual reduction. But for some, this is how they do it, and they get some benefit from that. Now, calories. Now, that is a big thing. The calories is a big thing. It's something that we tend to downplay, especially when we're eating in a more healthy way and we're getting enough exercise. We tend to downplay the calories. But if you have type 2 diabetes and you want to reverse it, you must limit your calories. It's more effective when you limit your calories. And I'll show you the research that shows that. The glycemic index, this is the tendency of foods to cause the blood sugar to go up. You want things that have low glycemic index and otherwise low glycemic load, we call it. So things that when you eat them, they don't have a big tendency to push the blood sugar up. The amount of fiber, and by the way, the only fiber that makes sense for us dietary-wise is plant fiber, okay? That's the only fiber we're talking about. We're not talking about, muscle fiber, and that has no value to us in our health journey. So the plant fiber, we want to have good amounts of plant fiber. Unfortunately, for some people who are very much involved in the juicing idea, what juicing does, it takes out the fiber, okay? And because it takes out the fiber, you actually convert something that otherwise would have been more healthy for you to something that is less healthy for you. Now, the issue with juicing, if you have a condition that requires high amounts of nutrients that you can only get by juicing the thing, then do it. But if you're going to assume that juicing is the be-all and end-all, and this is what you have to do, this is how you have to live your life, juicing for the rest of your life, I'm sorry. That is, food you eat, okay? It's better to eat your calories than to drink your calories. Am I making sense? Yes. Okay, now, before we go there. If, however, you have to take in large amounts, and some people with cancers and different things, they need to take large amounts. Rather than juicing alone, they should process the food by grinding it up. So using the kind of a processor like the Vitamix, okay, or one of those bullet things that essentially takes the whole fruit, the whole vegetable, and pulverizes it, okay. Now you can drink that as opposed to eat it. That's fine, because that will allow you to take in more. That is much better than actually the juicing. So that works out better. For instance, we've done actually in Great Britain, they did some studies looking at apples. They took the same amount of apple and they had it as apple. They took the same amount of apple and they had it as apple puree. They took the same amount of apple, they had it as apple sauce. They took the same amount of apple, they had it as unfiltered apple juice, the same amount of apple, and they had it as filtered apple juice. Which one do you think was more satisfying to people? Just the apple, okay? Just the apple. So some people ask me about the fruits and the dried fruits and this fruits and the that fruits. I say, tell you what, it's really simple to remember. The fruit, the whole fruit, and nothing but the fruit, okay? All right. Sugar. Most of us over sugar. I would like for you to seriously consider, whether you have diabetes, pre-diabetes, or whatever, seriously consider eliminating the added sugar in your diet. Eliminating the added sugar in your diet. Notice what I said? Added sugar. How much sugar does this have in it? So what do? We take water, we add sugar to it, we add color to it, and what do we have instead? Sugar water, we call it Kool-Aid, we call it all those other things, right? Are you following what I'm saying? Yeah. We've sugared up ourselves, right? if we do that, we'll make a big difference in how we live and the quality of life that we'll have. And people who are trying to get their diabetes under better control, they need to control the processed foods and the added sugar, the free sugar that they have in their diet. Okay? Fructose. High fructose corn syrup is sugar. All right? It's sugar. Get rid of it. Now, fructose as part of the fruit acts differently from fructose taken out of the fruit and put into water. It's processed. Okay? There's no fiber along with it. There's all of the other things that are supposed to be with it are not there, and now it has not the same effect. And part of the problem with fructose is not an increase in your blood sugar immediately, because if you were to take a handful, okay, whatever measure, a cup of fructose versus a cup of table sugar, and you did the table sugar, it will cause your blood sugar to go high. If you take the fructose, immediately it will not cause your blood sugar to go high. And you'd say, oh, this is wonderful. But what you don't know is that that fructose will then act on your cells to produce higher amounts of triglycerides. That's fat in your blood. Do you want that? Does that sound like something good to you? That increases your risk of heart disease. It increases the risk of depositing fat in your liver and in your pancreas. So over time, what happens? It actually deteriorates your diabetes. It causes it to get worse. So high fructose corn syrup, don't go there, right? Starches. There are different kinds of starches. I'm not going to get into that because my time is running short. I think I'm going to have to ask for some other time because I'm not even at the point of hypertension. Saturated fats, we say saturated fat is bad fat. Monounsaturated fats are better when we're looking at the issues of diabetes. And monounsaturated fats, I don't know of anybody who goes into a restaurant and says, can I have a plate of mono, please? No, they don't know what you're talking about, right? So where do you find monounsaturated fats? We have avocados, right? We find it in nuts. We find it in seeds, okay? So monounsaturated fats. Omega-3 fats, there's some issues in excessive, going excessive with the omega-3s, but most of us don't get enough omega-3s. So we get that in flax, by the way. We get it in chia. You guys know chia? Oh, yeah. Right? Flax and chia and some of the walnuts and pecans and whatnot, we get some omega-3s from there. Alcohol, we say, if you don't drink, don't start. If you drink, stop. How does that sound? Real simple? All right. Next one. The presentation of the food, raw versus juice versus cooked versus nuts and seeds. Tell you what, we ought to eat more raw than we typically do. Okay? That's just how it is. To have an all raw diet is usually not necessary for anybody, and it may not even be the most healthy if you're eating an all raw diet without making sure that you're getting all the nutrients that you need from the food that is presented. But to have more raw in the diet is usually a better thing, okay? Because right now, there's some people who have never tasted a carrot. There are kids who have never tasted a carrot. They don't know what a carrot tastes like. Anyway. Nuts and seeds, these are excellent. Please don't adulterate them too much by baking them with all kinds of oils and salt, right? The raw nuts or lightly roasted. The roasting, by the way, brings out a little bit more sweet out of it. I like mine raw. I eat the raw nuts, almonds, and I find them delicious and sweet just the way they are, right? And of course the seeds. And then fermentation. There are different kinds of fermentation. There's alcohol fermentation and there's lactic acid fermentation. The alcohol fermentation we do not recommend for anybody. This is not a health-producing thing. This alcohol fermentation. However, lactic acid fermentation appears to provide some health benefits to us because today we know that lactic acid fermentation actually helps to modify what's going on in our gut, in our biota, in our gut bacteria. So using this kind of fermentation works. There are really three or four different things we say. One is lactate, the other one is ethanol, the other one is acetate. This is what produces vinegar. We don't want the vinegar, we don't want the alcohol, we want the lactate, okay? Processed foods, highly refined foods, we need to get rid of, okay? You see that? Let's try it again. Highly refined foods, fat, sugar, get rid of them, all right? So now, the most effective regimen for the metabolic syndrome, we'll stop at this right after this, okay? We need to lower the total amount of carbohydrate, especially the processed foods. That's what we need to get rid of, the processed carbohydrate. Eliminate the sugars, right? Any added sugars, artificial sweeteners, isolated fructose, easily digestible starch, we need to get rid of, right? That's the sugars. Replace the carbohydrate with good fats such as in nuts and seeds and avocados and olives and chia and flax, okay? That's what we replace that with. Natural fiber in the food is better than the added fiber to the food. So don't have refined food and then add fiber to it. No. Have the whole food with the fiber in it. You get the idea? Next one, moderation in calories. Don't overeat. Eat and not drink your calories unless you have some special indication to have to do that. Next one is mixed exercise. Walk to strengthen and also strengthen your muscles. So it's not just walking, but you also need to do some strengthening and, of course, the flexibility and so on that goes along with that. Sleep 7 to 8 hours per night. In your mental state, you need to take care of your mental, spiritual health. A merry heart still does good, like a medicine. Cultivating an attitude of gratitude. Being able to forgive and to live in peace. Let me tell you, the lack of forgiveness, we can have a whole week-long seminar on just the issue of forgiveness. This is a biggie. Many people are killing themselves, they're poisoning themselves because they have not forgiven other people, right? And next one, number 8, is lactic acid fermented vegetables for microflora and sometimes the use of medicinal herbs. This is an effective regimen for dealing with the metabolic syndrome, and I want to thank you very much for your patience. 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 Patience.